kids when they are little. They want to grow up and marry someone amazing, and to have kids with that amazing person. Just as being little kids and having a little brother or sister, they love being with them. And if the baby cries, they try to smile or make noises to cheer him up. There's a great desire to reproduce. Many couples want to have a baby, but they can't.
Do you think having a baby is easy? Well, it's not. In a world where teenagers are getting pregnant left and right, you're the one having the problem with having a kid. Our couple, Robert and Georgia, have the same exact problem. And we, as assigned as a team of doctors, are here to help Georgia and Robert with their problem. And we will give facts and advice and options to get pregnant when you're having troubles.
Welcome to Starling. We are Miss BC's tutor group, as she said. And for the past 4 weeks, we've been studying the infertility problem, of course. First, you heard from Erin Appel, which is, that's her baby picture, cutest thing ever. Then John Reiser, which is right there. You'll hear from Shakia Brown. You will hear also from John Nelson, Kim Anderson, Gilbert Lucas, and I am Emily Allison. Okay. Mothering to reproduce and have a baby, you pretty much, like, you gotta make sure the sperm can reach the egg and can get fertilized. The infertility is pretty much just that, where the sperm cannot reach the egg or just something's gone wrong. And for, like, you know, John said, for the past 4 weeks we've been studying specifically like 2 couples, and Shakia will explain more of their background information.
Okay, so our couple that we have been assigned with is Georgia and Robert. Georgia is 21 and Robert is 48. They met at college, and I know some of you may be thinking, well, what kind of 19-year-old girl would want to get married to somebody in their like mid-40s? Well, basically it was love at first sight, and they've been married for 2 years. And after being married for 2 years, they decided that they wanted to have a child. So they've been trying for a year to get pregnant. First is Georgia. She's been sexually active since she was 17. So she's been on birth control since she was 17. Or since age 20, sorry. And she had, prior to having sexual relations with Robert, she has had one sexual partner, which she has contracted chlamydia from. And chlamydia causes scarring within your fallopian tubes, so that was a huge red flag to us when we found out that she has had chlamydia in the past. Next is Robert. Robert was a ranch hand and worked in the oil field, but he decided to go back to college at age 45, where he met Georgia, and then they got married. He has had a motorcycle accident in the past when he was about mid-30s, and he has also rode bulls in the rodeo in high school. So this was a concern to us because we did not, having these accidents, it doesn't help with the sperm production. So next, talking about the production of sperm is Emily Allison.
All right. The male reproductive system plays a pretty important role in, you know, producing a child. It is estimated that about like 30% of infertility is due to male factors. Healthy sperm is pretty critical in making a healthy baby. And sperm is produced within the testicles, and within the testicles are their seminiferous tubes, where they pretty much like just start out and then they grow a head and a tail. After they grow and they're ready to mature, they go to the epididymis right here. And then in the epididymis, they finish their maturing and then get ready for ejaculation. And when they are ready to be ejaculated, they go through the vas deferens and then to the seminal vesicle, where they pretty much mix with the semen fluid. And then as soon as they're, ready to be ejaculated and all that, they go through the urethra and out the penis. And just with that, after intercourse, it'll like come up through the vagina, through the uterus, go to the fallopian tubes, find an egg, and only one sperm can fertilize one egg. So after it's fertilized, the egg will come through the fallopian tubes and attach to the uterus lining. And like I said, healthy sperm is pretty critical in making a baby. So John Reiser will explain healthy sperm and not healthy sperm.
What is a normal sperm? Sperm is made up of 4 different parts. The sperm head, which is about 5 to 3 microns in length. The acrosome, which is inside the sperm head, makes about 30 to 70% of the sperm head. And also the acrosome acts as part of the DNA, which it's the information that's stored and what makes the baby. The mid piece right here is what connects the head with the tail, and the tail is what helps it swim, and that's about 45 microns in length. And once it mixes with the seminal fluids, the seminal fluid has its own job. It's to protect, preserve, and deliver the sperm. And the seminal fluids are made in the seminal vesicle, where once the male is ready to ejaculate, the sperm comes through the vas deferens into the ejaculatory duct, which after that the seminal vesicle excretes the seminal fluids into here, which mixes with the sperm. And then after that, it comes from the seminal vesicle through the prostate, which adds its own fluid and gives it a milky white appearance. And a couple important things in there are fructose, which acts as sort of an energy drink for it, the ascorbic acid, which is another like a shield for it because the cervical mucus is slightly acidic, and the sperm, it becomes somewhat alkaline, and it helps turn it into a neutral base. The zinc and calcium help with protecting it, and the vitamin B12 also helps with the energy production. Next, with the female reproductive system and how that all goes underway is Aaron Appel.
Okay. The clinical nature of the female reproductive system is very complex. It involves several different hormones that are constantly changing levels. It normally operates on a 28-day cycle. Female infertility accounts for 30%, and it can be very hard to diagnose a problem because it can be so many things going on. It all starts in the brain with the hypothalamus. It triggers the pituitary gland to send a follicle-stimulating hormone to the ovaries. And then this is the ovary cycle. The follicle-stimulating hormone helps it mature, and right before it bursts, it jumps up, and because that's what helps it. And so if you are pregnant, this corpus luteum that comes from the empty follicle, it continues producing estrogen, and if you aren't pregnant, then it begins to fade away. Alright, so this picture I drew in class to help understand better the female reproductive system. And so it starts in the hypothalamus, it triggers the pituitary gland. The pituitary gland sends a follicle-stimulating hormone to the ovaries, And as the ovaries begin to mature, it sends estrogen to the uterus to tell its walls to begin to thicken. And it also sends estrogen up to the brain to tell the pituitary gland that to send luteinizing hormone back to ovaries to have the follicle begin to burst. And right before it bursts, it sends a chemical to the fallopian tubes to come over to the ovary and collect egg. And once the egg is inside the fallopian tube, it travels up to about right here, and the sperm meets it and fertilizes it, and it comes into the uterus, and that's where it gets attached to the wall. And so if you are pregnant, you get HCG, which comes from the fertilized follicle, and you get hormones, and then the corpus luteum sends estrogen to keep those walls, uterus wall thick to help hold in the baby. And if you aren't pregnant, there will be no hormones, and it sheds with the lining of the uterus and starts a period. So far we've talked about the Robert and Georgia, the male reproductive system and the female reproductive system, and Gilbert's going to talk about male infertility.
Hi, I'm Gilbert Lucas. I'm going to talk to you a little bit about male infertility. First, us as the doctors, we were trying to find out why they were unable to reproduce, and the first thing we thought was azoospermia, which is a complete absence of sperm, and that was not the case. So first, the production, if it was produced wrong, then it would not be able to swim right to get to the semen or the egg. As you see here, this is a normal sperm, and next to it there's bigger, smaller, doubles. Anything can happen to it to make it not swim right. And next, the delivery. If something is blocked in the male, so the sperm cannot get to the semen, then it is unable to produce. And next, lifestyle issues. If the couple has ever overly drank or overly used drugs, then that can play a huge part in infertility. So as we know, Georgia and Robert have both experimented with marijuana when they were younger. And also wearing tight pants can keeping the testicles up close to your body is not a good thing, because the testicles are not meant to be warm, and your body temperature is just too warm for them. So it's not supposed to wear tight pants. And next is age. Age plays a huge part in infertility. Once you hit a certain age is about 40, you do not produce as much sperm. And believe it or not, this is true from the Center of Disease Control. And next is varicocele. And if you see these blue little veins, those are not supposed to be even close to that big, not even half that size. Varicocele is the veins within the testicles, swollen veins within the testicles. And you can also find this on your legs. And doctors can easily find it in a physical, and it can easily be treated with surgery. And if you overdose on medicines or medications, then that can also give you a higher chance of low sperm count. And injuries. Injuries played a huge part in this, because as we know, Robert injured his groin in a motorcycle accident, and he also rode bulls, so that didn't help the groin either. And if you get injured, it stays with you, and that'll mess up your sperm production. we decided to give Robert a semen analysis. More on that will be drawn later.
There's a few things we test for in a semen analysis, such as the volume, sperm count, viscosity, motility, the forward progress, the morphology, pH levels, the white blood cell count, and fructose levels. Few of these things are extremely important in this, such as the sperm count, viscosity, the forward progress, motility, pH, morphology, white blood cell count, and fructose. And sperm count is really important because if you have little sperm but a lot of semen, then you have less of a chance to conceive and have a baby. Viscosity is like the liquefaction time with how long it takes for it to turn from a gel into a liquid. Motility is how many of them are moving. Forward progress is how many of them are moving forward. Morphology, like Gilbert said, is what they look like. pH is extremely important because, like it's been said a couple times, the cervical mucus is acidic, and it's hard for the sperm to make it through there while it's acidic because it doesn't survive in acidic environments. The white blood cell count can show if there's an infection or sickness. The fructose levels shows how much energy it has left over and how much it can use. And now we have Robert's semen analysis versus a normal semen analysis. Robert's viscosity was the +1, which means that it liquefies in about 10 to 20 minutes. The appearance is opaque, which is good because of the prostate, and that means it's healthy. The volume was 5 milliliters, which is good with the average of 2 to 6. The count was above average with 55 million and no average being 20 million. Motility was extremely good with 90% and the average being 50. Forward progress was good, which evens out with the normal results. Morphology was 79%, which is better than the normal because it's normal is 60. So now we can conclude that Robert's semen analysis was good. And now Shakira Brown with the causes of infertility for the female body.
So as I stated earlier with the chlamydia, it causes damage to the fallopian tubes. So the leading causes of female infertility are damage to the fallopian tubes, hormonal causes, and cervical causes. And I will go in more depth in each one in the next slides. First is damage to the fallopian tubes. One of the reasons it can be caused to is an STD, as stated earlier, such as chlamydia and gonorrhea. What chlamydia does to your fallopian tubes is it blocks here and it causes the buildup and it scars, and so the egg and the sperm can never meet, so the egg can never be fertilized. A next cause of damage in the fallopian tubes is a premature egg development, which also causes blockage within the fallopian tubes when the egg develops within the fallopian tube. Another cause of fallopian tube damage is previous surgeries within your abdomen or pelvic area, which can also cause scarring, which again also causes blockage. So that's what happens when it blocks and the egg and the sperm can never. Next is polycystic ovary syndrome, and what it is one of the leading causes of female infertility. And one of the symptoms is when your menstrual cycle is irregular, and this is due to because being affected by hormones. It is affected by hormones because the pituitary gland within the brain, as stated earlier with the hormones, releases too much prolactin. And prolactin is a follicle stimulating hormone. And when you have too much of that, you don't get enough of the luteinizing hormone, which tells the corpus luteum to release the egg out of the ovary, and so it can go swim through the fallopian tube. And when it doesn't release, it causes cysts on your ovaries. And so this is a picture of what it looks like when the PCOS happens. And this is a normal ovary, and that's what PCOS looks like within your ovary. And next is cervical diseases. And this is caused by cervical mucus. Well, cervical mucus is one of the reasons. And the cervical mucus is a thin, stringy substance produced by the cervical glands and stimulated by the female hormone estrogen. And what it does is it helps the sperm swim to meet the egg within the fallopian tube. So if your cervical mucus is too thick, the sperm can never swim to meet the egg, and the eggs never fertilize. And when it's basically thin or insufficient and it's just obsolete, the sperm just washes out through the uterus because it can't live and survive in a thin mucus and meet the egg. Mucus is also hostile to sperm. Within your cervical mucus is antibodies, which protect against certain diseases, and sometimes these antibodies in the mucus mistake the sperm for a disease, and they become hostile towards them and basically kill them, and so there is no sperm, once again, to fertilize the egg. One of our diagnoses was a hysterosalpingogram. As stated earlier with the STDs on how it causes scarring within your fallopian tubes, what we wanted to do was we wanted to check Georgia for a hysterosalpingogram to see if there was scarring from the chlamydia that she's contracted in the past. And what a hysterosalpingogram is, it's a dye test. And they inject dye through your uterus up to your fallopian tubes. And if there is scarring within your fallopian tubes, the dye doesn't wash out. And if there is not scarring, the dye washes out completely. And this is an x-ray of somebody who has a hysterosalpingogram done. And the dye washed out through the abdomen, so there is no scarring in that one. And if there was scarring, this whole black stuff right here in the abdomen wouldn't be there. It would all still be within the fallopian tube and in the uterus. So it checks for scarring and blockage. And again, blockage prevents the sperm and egg from meeting. And Georgia's hysterosalpingogram, it didn't flow out through the abdomen. It was stuck within the fallopian tubes. So knowing that she has scarring in there, we can recommend other treatments and options, and more on that will be Kim Anderson.
A few of their options are they can decide not to have kids and they can adopt. And if you adopt through a private adoption company, can range in price from $5,000 to $40,000, and it can take about 2 years to be finalized. And medical options, they can have a procedure done, a tuboplasty, which will clear out the fallopian tubes and it'll give her a higher chance of getting pregnant. And there's also the option of in vitro fertilization that John Nelson will talk about.
Okay, in vitro fertilization is where what Shakia said, that it's blockage in the fallopian tubes. So what they do is they do surgery, and then which they give FSH, fertilized follicle stimulating hormones, which helps the eggs produce or mature. Well, sorry. What they do is they surgically remove the eggs out of the female, and then they take it to a lab, which they take a needle and where they collect sperm, and then they do it microscopically, and then they insert the needle into the egg, and then it can be on either side of the needle, and then they inject and then they inject the sperm into the egg, and then 5 days, 5 days later, this is a blastocyst. This is what a mature egg looks like. After 5 days, then they insert the egg, then they insert the blastocyst back into the uterus, which attaches to the walls, and then it produces. And the cost of it is $13,755. That doesn't include with insurance, and usually insurance doesn't cover the whole procedure of in vitro fertilization. Artificial insemination. This is where the fallopian tubes are not does not have blockage. So what they do, they take a catheter with sperm and then inject it through the uterus, and then which goes through the fallopian tubes, and which helps the sperm swim to the egg if a male can't do it, but he still can produce sperm in order to have it through catheter to the female. The cost is $1,500 to $4,000, and it does cost less because they don't. It costs less because they don't have to do as much of surgery or have any medications certain to help the sperm to get to the egg. We have next we're going to be learning about another couple, Ronnie and Mary, which Kim will talk about.
During this problem, we took a look at another couple who have dealt with infertility, and their names are Mary and Rodney. At first, after trying for about a year of not successfully having a child, they went to a doctor and they were put on Clomid, which worked successfully the first time for having a child. But after that, after a few years, they wanted to have another child, and Clomid did not work again. So they tried letrozole, which is normally a breast cancer treatment drug, but due to some of the side effects, could help with the ovulation, but that wasn't successful. And Menopur is another thing we use. It's a follicle stimulating hormone, which helps the eggs grow, and that didn't work successfully. And the Follistim is what they use for the artificial insemination for her, and what that does is they want to get the egg to the desired size, which is about 40. And when she had to have that done, they had to stay in Fort Collins where the doctor is. And for that, each day she'd have to have an ultrasound of her ovaries so they could measure the eggs across. And when she had that done, she got one egg to that desired size, and that was not successful either. But when you're little, you never dream of not being able to have a kid. And 100 years or so ago, if you couldn't have a kid, there's nothing you could do for it. And that's just how it was. And due to the technology today, there's so many ways you could have a kid. We'll be happy to answer any questions.
So did they actually have a child?
Mary and Rodney, they had one.
Prior to all the stuff they did the second time?
No,
They tried the
the
Clomid
Clomid worked for the
for the first daughter.
but then there's haven't gotten anything yet. And this was my paper that I do for my presentation. Pass it around.